Hello, I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida. The topic today is how to deal with manic depression mood swings. Some of the materials you might need would be a quiet place, a piece of paper and a pencil, or a journal in order to reflect and to be able to record your thoughts. Manic depression is a type of mood disorder that by its definition has lots of highs and lots of lows. The mood swings can come very rapidly, they can sustain for a long period of time. And so how do we deal with these manic depressive mood swings? It's important to recognize that unlike a lot of depression, which is really thinking depression or cognitive depression, manic depression is a biological endogenous type depression. There's some chemistry in the brain or hormonal issues that create this disorder called manic depression, or what we more typically use is bipolar. So how can we begin to kind of deal with that? Well, it's important to recognize first that it is a biological, it is a chemical process. And so when you begin to feel some of these symptoms coming on, if you're going to the high end, you're going to go from more of a kind of a down, melancholy, kind of a unmotivated, kind of tired state to a much more expansive state where you're going to be much more alert, much more grandiose in your thinking, high energy, feeling very good about yourself, almost of an exaggerated kind of ego or self-acceptance piece. And so you're going to shift from that low to that high fairly quickly. And how you deal with that is, one, just recognizing that you have this tendency at times. Although I will tell you it's very difficult to manage this mood state without medication because it's so chemically, biologically driven. It's hard to override it simply by challenging and disputing thinking. One of the things you want to be able to make sure you do is accept the fact that you have this disorder, which is very difficult for folks. Now, interestingly, most people really enjoy the manic side of this state, but obviously, or not obviously, but they do not enjoy the downside. And so a lot of people who have manic depression or bipolar disorder do not comply well with medication because they like the manic side, because they tend to be very productive. And as long as that manic side isn't too out there, they tend to have lots of energy, they tend to get tasks done, they seem to multitask very well, they just feel very good, so oftentimes do not want to go to medication to kind of tone that down. So how do you deal with it? You recognize, one, it's biologically driven. Two, you're probably not going to do a good job of managing that without medication. And three, you can still override some of that with thinking, recognizing at times you're not going to do a very good job. I'm Dr. David Thomas, talking to you about how to deal with manic depression mood swings.